course, what are some in-office, in and out of office procedures that we can do to get ready for summer?
So if you're talking about non-surgical, okay.
Yeah.
Oh, surgical, you're talking about, okay,
yeah.
so in-office surgical. Okay, so I'm going to say that, and this is for women now, for women, probably a breast augmentation for a lot of women is an important, it can be a very uplifting, if you will. I know it's kind of a joke, but it can really be an uplifting, uplifting to the spirit of the
Right.
woman. And when I say woman, I didn't say young women or old women, because it's all ages. It's amazing the age range of women who are coming in for breast augmentation enhancement, what a difference it makes. You know, some people can be haters and they can be judgmental about whether women do this or not.
Right.
I will have to tell you that there are studies that have shown that probably the number one procedure in terms of a woman doing something for themselves, in terms of making them happy and feeling more confident, is breast augmentation. And I feel that especially for that subset of women, when they're thinking about going to the pool, going to the beach,
Right.
just hanging out in the summer where we wear less clothes, that they do absolutely feel more confident.
Right.
I know that we're busy in surgery, and we talked about what should we talk about today. And, you know, if we talk about surgery, when can we get them in? When are we booking now?
Yeah. May,
June. Okay. And that's still not too late.
Right.
That's still not too late to have a procedure done and to feel good and improved, if you will, and more summer ready for our patients. Okay.
Exactly.
In terms of for men and women, so let's not forget the men.
Yes.
What I would say is that if they have we're going to go to the breast again.
Yeah.
And in fact, we had a show earlier last month about male gynecomastia,
Right.
which is male breast enlargement. That can be very, very embarrassing for men.
Right.
Okay, they're afraid to take their shirt off. Okay, they get teased from a young age if they have male breast enlargement. You know, guys can be mean and do, you know, twisting on them, you know, pinching them and so forth. And it's interesting that I recently have been taking care of men with gynecomastia who are in their 70s, right? We just did, right?
Yes.
2 patients, okay. One with severe gynecomastia and one who had moderate gynecomastia. But it's interesting how it affected their self-confidence. And I have to say that it is one, in my opinion, it is equally as great at achieving customer satisfaction as a breast augmentation for men. So men, if you are, you know, concerned summer's coming on, taking off your shirt, you have male breast enlargement, please just give us a call. You can first start off with a virtual consultation, if you will, if you feel more comfortable that way. We will ask you to send some photos in, you know, maybe with just your t-shirt off, so that we can kind of evaluate you, see if you're somebody we can help. All of these procedures, whether it's breast augmentation for women or whether it's gynecomastia surgery for men, all of these can be done under local anesthesia, probably at most a couple of weeks of downtime, maybe. And certainly in terms of being, you know, at the family reunion, being out there in the outdoors and being a little bit more exposed, that we can definitely achieve that. It's not too late to give that as a consideration getting ready for summer, right?
Yes.
Yeah. So thank you. I think those were great. So in terms of our surgical options getting ready for summer. So in summary, let's just summarize here. Karina, thank you so much for coming. I actually, it does make, I feel like I'm just proud of you when I listen to you talk about the different things. So for a quick summary for the medical treatments we're talking about is what? Just the name, list them.
We're going to talk about peels,
and laser hair removal.
And sunblock.
And sunblock. And from the surgical side, we're talking about, for that quick pick-me-up, if you will, breast augmentation in the appropriate female patient, okay, and all done under local. And for men, treatment of male gynecomastia or male breast enlargement.
Yes.
So will you come back again if we can't get Denora to come?
She will be here.
You're going to force her. Okay.
No, I'm kidding.
Okay, all righty. Well, I want to thank everybody for listening to us. I'm Dr. Tom on Ask the Expert, and I'm wishing everybody a great weekend. Thank you.